Welcome back to the channel, everyone. Today we are tackling a topic that affects millions of men and their partners worldwide, but is rarely talked about openly. Premature ejaculation is one of the most common sexual dysfunctions in men, typically defined as ejaculation that occurs sooner than desired, often within about a minute of penetration. This condition is frequently accompanied by severe psychological distress and can cause significant relationship difficulties. However, despite how common this condition is, the statistics are staggering. Only about 9% of men actually seek medical help. Why? Because of the intense stigma and embarrassment surrounding it. But what if the solution didn't require a daunting doctor's visit or prescription pills? What if a therapy program could be completed entirely in the privacy of your own home, right from your smartphone? Before we dive deep into a groundbreaking new clinical trial that is changing the landscape of men's sexual health, I have a quick reminder. Please make sure to subscribe to the channel, follow, and turn on notifications so you never miss out on our latest evidence-based health updates. Let's get started. Recently, fascinating findings were presented at the European Association of Urology 2026 annual meeting. Researchers conducted a randomized study known as the CLIMACS trial to evaluate a smartphone app specifically designed to address the psychological factors of premature ejaculation. The app, named Melonga, is a digital therapeutic tool that was carefully developed by a team of urologists and psychologists. The goal was to help men manage this condition through behavioral training delivered directly to their phones at home. Dr. Christer Groben noted that this novel app-based behavioral therapy specifically appeals to the vast majority of men who avoid seeking medical help due to stigma. So, how does it actually work? The program teaches patients techniques that are commonly used in traditional clinical sex therapy. These include mindfulness training, arousal awareness exercises, cognitive behavioral strategies, and physical control methods like the famous start-stop technique. Furthermore, Dr. Groben explained that about 1/3 of the app's content focuses on communication, teaching men how to talk to their partners and find ways to express their sexuality beyond just the penetrative act. To test if this digital tool actually worked, the CLIMACS trial enrolled 80 men who had no other underlying health conditions. These men were randomly assigned to either use the app or receive no intervention for a period of 12 weeks. During this time, participants used a stopwatch to measure their intravaginal ejaculation latency time, or IELT, and completed validated questionnaires. Out of the 66 men who completed the full trial datasets, the results were incredibly clear. The smartphone app significantly improved sexual control and successfully doubled the user's ejaculation latency time. In the group using the digital therapy, the average time from penetration to ejaculation increased from 61 seconds to 125 seconds after the 12-week program. In stark contrast, the control group experienced almost no change at all, seeing a microscopic increase of just 0.5 seconds. But the benefits didn't stop at just the stopwatch. The men's sexual quality of life scores increased substantially, and their scores on the premature ejaculation diagnostic tool decreased, indicating much fewer symptoms. Most impressively, 22% of the men who used the app no longer met the diagnostic criteria for premature ejaculation after 12 weeks. Dr. Giorgio Russo, an associate professor of urology at the University of Catania in Italy, commented on these fantastic results. He pointed out that there is a massive amount of misinformation out there. This app acts as a trusted, single resource that brings together effective advice from real medical professionals. Dr. Russo highlighted that it is especially notable because the intervention successfully improved symptoms without the use of medication. However, it is important to note that the app is not necessarily meant to completely replace pharmacotherapy or psychotherapy. Instead, as Dr. Groben suggested, it can work brilliantly in combination with these other clinical approaches to provide a holistic treatment plan. The ultimate goal is to improve the way men think about and handle their sexuality, which directly improves the quality of life for both them and their partners. The Melonga app is currently expanding its reach and is available in several European countries, including Germany, Ireland, Austria, Luxembourg, Liechtenstein, and Belgium. Digital behavioral therapy is proving to be a powerful, stigma-free tool in the future of men's sexual health. If you want to dive deeper into the science behind the CLIMACS trial, read the full studies, or explore more about this topic, please go to HealTalk.org for more detailed scientific sources. Thank you so much for joining me today. If you found this video helpful, please subscribe to the channel, follow our page, and turn on those notifications so you are the first to know about the next big medical breakthrough. Stay healthy, and I will see you in the next video.